it's clearly understood that airports or any land borders cannot prevent a disease from entering. People in the incubation period can cross that border, can enter countries, and can then infect others when they become sick. So its borders are not a means of preventing infections from entering a country by checking temperatures. Borders are important because you can provide to people arriving from areas that might be at risk of having had infection, providing them with an understanding, either a printed understanding or a verbal understanding, of what the signs and symptoms are of this infection and what they should do if they feel that they might be infected. Vaccines are under development right now. There's a lot of research going on. That research requires first that the vaccine be developed, then that it be studied for safety and effectiveness in animals who are challenged with the virus when they're vaccinated, and then it must go into human studies. The animal studies have not yet begun, but will soon begin for certain vaccines. And it's thought that by the end of the year or early next year, there may be some candidate vaccines that can then be studied for licensing by regulatory agencies. So we're talking about at least a year until there's vaccine available that can be used in many populations. That's clear. We know how it transmits. We don't know how easily it transmits in humans, in communities, or in unenclosed areas. We know, for example, that in the enclosed area of a cruise ship it spread very easily. We need to better understand how it will spread once it gets into more open areas where people are exposed to people who might be sick. A major problem in the world today is that we look at outbreaks in developing countries as something that we need to go and stop. So when there's an outbreak of Ebola, we think, how can we go and stop this outbreak in the country? We don't think about how can we help that country strengthen its capacities so that it can detect and respond to infections. So we haven't invested enough in helping countries develop their core capacity in public health. What we've done is invested in many mechanisms globally which can provide support to other countries to go and help stop outbreaks. But we want to see a world where every country can do its best to stop its own outbreaks. Today there are over 7 billion people. And when those people come into the world, they demand more food, they demand a whole series of things, and they live closer together. In fact, we're in an urban world where people live in urban areas. And at the same time, we're growing more animals, and those animals are contributing food to humans as well. So what we see is that animal-human interface is becoming closer and closer together, and this intensive agriculture of animals and this intensive increase in human populations living together on the same planet is really a melting pot where outbreaks can occur and do occur. We will eventually have more and more of these outbreaks. So an emerging infection today is just a warning of what will happen in the future. We have to make sure that technical collaboration in the world is there to work together to make sure that we can understand these outbreaks when they occur and rapidly provide the information necessary to control them. I can't predict with accuracy, so all I can say is that we must all be prepared for the worst case scenario and at the same time learn how we can protect ourselves and protect others should we become a part of that epidemic.